When it comes to dealing with cancer, there's proof that knowledge is power. Today in Health Matters, we look at how physicians in Southwest Florida are making major strides in cancer care. Cancer researchers are making headway every single day when it comes to learning, treating, and preventing cancer.
Our learning curve is actually in what's called the exponential phase, which is the part of the curve where you're really starting to learn very quickly about these things. So you're making very big strides very rapidly.
Medical oncologist Dr. Frank Rodriguez outlines three major areas of progress in cancer research and treatment.
Number one, we have more effective drugs. For any person who's getting chemotherapy, the chances of benefiting from chemotherapy are probably higher now than they were, say, 15 years ago.
How the body reacts to treatment is also getting better.
Number two, we've improved significantly on the supportive care medications. So for those patients who get nausea, for example, we have excellent drugs now to prevent that. So people can go through chemotherapy and still do relatively well.
Finally, the course of treatment is changing, and for the better.
Lastly, and perhaps most importantly, is that we're improving on our way of choosing patients. Okay? So whereas before we would give chemotherapy A to every woman that had breast cancer, we're finding out that maybe 20% of women should get chemotherapy A, but there's another 90% of women that may benefit from chemotherapies B, C, D, or E.
This type of individualized care is determined through various methods, including the Cancer Care Navigator Tumor Board. That's when physicians, oncologists, and radiologists involved in the care of patients meet together to discuss a patient's personal treatment plan.
We always have discussions between the doctors. The tumor board, which is also another place where we can sit down and discuss the cases with the surgeon, with the pathologist, the radiation oncologist.
Dr. Rodriguez adds that patients should never hesitate to talk to their physician about any concerns they may have when it comes to their diagnosis, treatment, or aftercare. Reporting for Lee Memorial Health System, I'm John Bafar.